share your treatment. We've done a little bit of numbing across the top lip. You doing okay so far? Okay, good. So we're going to do a little more numbing. We're doing full face fillers today. Do you feel a little pinch here? Not too bad? Okay. We're not in a little pinch there. And we'll go slowly. You feel a little pinch? So just for the creases. Yeah, we're going to do the creases, but we're going to leave the lip size alone, okay? There we go. And it's good to clarify, but I still numb the lips completely. It feels much better, much happier experience. And very proud of Mary. We get to take care of Mary today. She takes care of everybody else, but now it's time to take care of Mary. Now that I've done some numbing around the lips, I'm going to turn your head to the side. So Mary, you're going to feel the buzz and then pinch over here. 1, 2, 3, pinch. You feel small, medium, big pinch. What do you feel there?
Medium.
Medium, okay. We'll go slowly. Now how about here? You'll feel another pinch. 1, 2, 3, pinch. Small, medium, or big pinch there?
No.
Small, okay. And then another little pinch. 1, 2, 3, pinch. And then pinch on 3. 1, 2, 3, pinch. 1, 2, 3, pinch. How about there? Small, medium, big, not too bad? Medium, okay. We're not in a hurry. We take our time and then pinch on 3. 1, 2, 3, pinch. We're going to be doing some of the Bellafill permanent filler. We've got some of the fine line filler for the creases in the lips. Per Mary's request, she doesn't want to plump the lips, so we're just going to work on the creases. I'm going to turn your head to the side. And she will pass the grocery store test today. Little pinch, 1, 2, 3, pinch. Which means we walk into the grocery, nobody really does a double take. Pinch, 1, 2, 3. 1, 2, 3, and thank you to Brandy and Justinia. Have everything set up so perfectly. And Kim is our camera person for today. Justinia, if you can tag, if you want to watch some of this, Kim, I just want to make sure you have time to do your stuff too. But otherwise, they can tag you out when you're ready. I know you got your calls to make. You feel a little pinch, 1, 2, 3, pinch. And then pinch, 1, 2, 3, pinch. Mary, how you doing? You doing okay? Very good, very good. Pinch. Pinch. All right. So now we're using the Bellafill. That's the permanent filler. I like to start with the fine line filler because once you numb the lips, the blood supply is very good to the lips and it washes that out very quickly. So while you're numb, then we like to put a little bit extra here in the corner of the mouth. Now here you feel another little pinch there. You doing okay? Small, medium, big pinch, not too bad? Not bad. Now it makes it goofy to talk because that's because of the numbing medicine. Thank goodness for lidocaine, but it's not good for, the lidocaine lips are not easy to talk with, that's for sure. But it's great for procedures and treatments. And it's so gratifying because very quickly you see these tiny little creases, they really do plump right up. And you can't make them gone 100%, but we definitely make them better. And sunscreen, sun protection helps us. You can use wrinkle relaxer, microneedling, laser resurfacing does a good job for these as well. Perfect. For those of you who are just now joining, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon here in the Villages and in Tampa, Florida. Performed over 4,000 facelifts under local anesthesia. That is the safest way to do the treatment. You don't need the old-fashioned general anesthesia technique. You don't need IV sedation. No surgical drains, no surgical staples. So this is the trend that patients are choosing because they don't want downtime, as much downtime, they don't want recovery. So fillers, obviously there's no downtime. And you can learn more by downloading our book on Amazon. We guarantee we can make you look younger. Hit the Wall Street Journal bestseller list. Perfect. Mary, how you doing? You doing okay? We try and make it easier than the dentist's office. No root canals today. And the lips, I've had patients tell me they went to providers that they did the lips with no numbing. That's very sensitive. So I like the numbing medicine personally. And Joan does too.
How many syringes for the lip wrinkles is being asked?
So we're doing one for the lip wrinkles, and we've got 8 Bellafill. We've got 8 Bellafill because we're doing that full face. And we've got another fine line filler, 2 total fine line fillers for just the creases around the smile lines. I use these, we call them fine line fillers. It's for finishing touches. And then the corners of the mouth is an area that we get a lot of downturn, and we're just filling that area in. Everything's looking good. Perfect. So now that I've addressed the fine line wrinkles around the lips, I'm going to start doing the Bellafill, and then I can come back with fine line filler for the finishing touches at the very end. But I like what I see. It's already a nice improvement, and we're just going to keep making it better and better, one tiny injection at a time. Perfect, okay. So now, I like to start with the full face injections around the cheeks because that is a buttress where when you lift the cheeks, everything else lifts as well. And so I have my 27 gauge cannula. I like to use some injectors prefer the 25 gauge, but I like the control, and it's a smaller gauge cannula, so then I feel we do get a little less trauma with the smaller cannula, and I get some accuracy and precision about where I place the cannula. Everything's looking good. You doing okay? Very good. I feel a little bit of a pinch here. Perfect. Just hold a little pressure on this side for me, please, Brandy. Thank you. Thank you for your comments. Thank you for your questions. We are in Tampa and the Villages, Florida. I'm a double board certified facial plastic and reconstructive surgeon. Patients today are living much longer. They want to look better. When we look in the mirror, can you hold a little pressure right on this spot here too, please? If we don't feel it matches what we feel on the inside, it's, we want to do something about it. Okay. So this is the Bellafill. I mix in a little extra lidocaine. I stay about 10 millimeters below the inferior orbital rim, and I'm building up the cheek here. So you'll feel a little pressure, a little pinch. Do you feel pressure pinching there? What do you feel right now?
Nothing.
Nothing, okay. Thank goodness for the lidocaine. So I use this shiver technique, but if you watch, I'm doing a fanning technique, and I shiver because it allows me to put a very, very fine amount of the filler over a large area. So right there, I've done about half of the syringe, and I'm going to go back again. Once I've injected some, it's easier to make subsequent passes. Twist, twist, twist to atraumatically advance the cannula as much as possible. Shiver technique for a very fine amount of filler over a large area. I'm using the smart finger to assess where my cannula is. So I'm very accurate in where we layer the product. So I'll start out with 1 cc syringe of the Bellafill, which is 0.8 cc's of the product, and we do mix in a little bit of the lidocaine for extra comfort and to reduce the viscosity. I'm gonna take a little extra and do the submalar region. Everything's looking good, Mary. You doing okay?
Mm-hmm.
Very good, very good. So when you're judging your provider, you want to know how many treatments have they done. I've done over 20,000 syringes of facial fillers. You get the hang of it after a few thousand. And then it's important to assess the team. Do they have a good team? We've got over 35 staff. I'm super proud of our team, and I feel like I work at the Ritz-Carlton every day. They take great care of me. They also take great care of you and our patients. Pardon me, Brandon, I'm going to squeeze through here. Let me turn your head this way. It is important to assess, do you feel your provider is a good communicator? Because you want to make sure they're giving you a result that you feel good about, not just a result that they're thinking fits for you, because there is some variety and variability. Little pressure, a little pinch. Everything's looking good. I love the instant results that you see and no downtime. 50 years ago, they did not have this ability to do this type of precision. Cannulas did not exist back then, so it was more traumatic to do the injections. Thank goodness for modern medicine. It just keeps getting better and better. Very good. Mary, how are you feeling?
Okay.
Very good, very good. So now, once you inject one area, the proportions in the face will change. So then I reassess with every treatment we do. You mind tagging it around? Oh, thank you so much. So Jasenia is going to be our camera person now, so we built in the cheeks. But I'll tell you what, we're going to do a great job here centrally. She's going to really appreciate that. So now, I'm going to turn your head this way just a little bit. Are you feeling any pain right now?
Mm-mm.
Me neither.
Thank you.
Everything's looking great. So twist technique, twist, twist, twist. We're in the subcutaneous plane. And when you're doing a very fine amount over a large area, I'm going to turn your head this way nice and easy. You're really just thickening the facial mask, and that's what makes it look so natural, is you're maintaining the proportions. Perfect. Very good, very good. I'm so happy with what I see. So that's building up, that's the submalar hollow. A lot of people are getting the buccal fat pad removal. If you do, you're going to find as you get older, you're going to get hollow in that area. So I try not to remove the buccal fat pad, if at all possible, because you're going to want that volume later. Very good. So this is subcutaneous plane, shiver technique, fine amount of filler over a large area. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We have Tampa and the Villages are all our locations. We do 3 or 4 seminars every month, so check out our imagelift.com/events, and would love to see you at our next event. Download, we have our 2 Wall Street Journal best-selling books, The Smile Prescription, and We Guarantee We Can Make You Look Younger. Okay, so let me turn your head just a little bit this way. So now, I want to do a little bit in each temple because we do get a little temple hollow there, and patients appreciate it when they can fill that area. So twist, 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 subcutaneous space, hydrodissection, tiny amount of the product, inject over a large area. Perfect. So I'm just gonna use half a syringe at a time, little pinch there, you'll feel that ease up. You feel small, medium, big pinch there, Mary? Not too bad? Medium, okay. You're gonna feel that settle down. Perfect. And I'm massaging and blending as we inject. Thank you. Thank you, Brandy. Okay, so twist, twist, twist. I make that tiny little pore-sized opening because the cannula has a blunt tip, which is what makes it safer. So the safety of the cannula is paramount. And I just really don't believe in needle injections in most areas of the face except for the lip. When you're acting superficially, you can do dermal creases with the needle as well, acne scarring with the needle, but most injections really should be done with the cannula. Very good, very good. It's very difficult to get the filler into a blood vessel with the cannula when you're using low injection pressures and feather touch technique, nice and gentle. Mary, how you feeling? You doing okay? Very good. Mary will pass the grocery store test today. She walks into the grocery, nobody does a double take. The lips will feel goofy for about an hour after we're done. That's just the lidocaine. And we're just focusing on those lip creases. All right, we're right on track. Now I'm gonna treat around the mouth. And what I really like about how they prep, let me turn your head this way, when we mix with the lidocaine, sometimes there can be bubbles in the Bella filler. Right now there's like no bubbles, it's all a gel, so I'm very grateful. The team did such a great job with that. Thank you very much. And then I'm gonna turn your head to the side for me. Is that okay for you like that? Very good. So we call this the melolabial fold. It's very normal that we lose volume around the face. So now we're just putting back what was once there to help our patients, to help you look like you again. If you look in the mirror and the reflection that you see doesn't match what you feel on the inside, we can help you. Twist, twist, twist to atraumatically advance the cannula. So I'm using about a half of a cc, half of a syringe. We fill them up to about 1 cc, and I'm immediately massaging afterwards. And turn your head this way. Very good. Find that little tiny pore. Twist, twist, twist. So as you can see, we keep patients comfortable. We have a lot of patients, they're very needle phobic. They lose their needle phobia after coming to us because they realize it's really not that painful. And we're not afraid of pain. If you hold ice in your hand, it's painful. People have this fear. They were traumatized when they were younger with a needle, and then they hold that fear with them. So when you realize, okay, well, a little tiny pinch doesn't really bother, and then it's numb, and then I'm not feeling anything, okay, what's there to be afraid of? So that's the process we use to help people get past their needle phobia, which is a real thing. And with some patience and with some time, you can overcome it and enjoy your treatments. If you need Valium, you can do Valium. I've got some patients, they say, oh, I freak out. It's like it's a badge of honor. Like they freak out I'm like, okay, well, you don't have to freak out either. You won't need to. You're gonna feel very relaxed. And they're like, no, but I really get crazy. I'm like, oh, you'll be fine. And then we show them and say, do you feel a little pinch? They're like, yeah, they feel in control the whole time. There's nothing to freak out. Remember, if somebody freaks out with a treatment or you have to kind of build up to that. You have to have like negative experience, negative, 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 and then you're like, whoa, you're freaking out. But if you're like, whoa, I got a pinch, negative, then you take a break and you go back to your baseline, you're doing good. So now I want you to look straight ahead. Can you open your eyes for me? I just want you to look straight ahead. So now we're gonna keep building. I wanna build the cheeks in this malar hollow. That's where she's gonna get her best result. You can go ahead and close your eyes if that's more comfortable for you. So I'm gonna focus 50% in the cheek, 50% in the inframalar hollow, filling the volume. I'm so happy with what I see. It looks really good. And we have the best staff. I love to be here at the office with our team. And we have the best patients in Tampa and the villages. A lot going on in this world today, and I'm just very grateful that we can do good things and can't solve all the world's problems every day right now, but we can help this world one person at a time. And many of our patients are caregivers, and they, being a caregiver, you can live your life in seclusion almost. So we are bringing that out into the public where we can be a part. We're all in this together, and we don't have to do it alone. And investing in ourselves allows us to care better for others, because we can't pour from an empty cup. So it takes courage to invest in yourself, but it's the best investment you'll ever make. And we just love to see the beautiful transformations every day. I had a patient I saw today, over 90 years old. And it's just beautiful, beautiful people changing how we define aging, choosing how they age. You can see how that submalar hollow is plumping out very nicely. Very good, very good. Perfect. Looking good. How are you feeling, Mary?
Great.
Very good, very good. So if you've had an experience where you've had very, very painful fillers, I'm so sorry. This is a good example of what fillers should be like. You feel comfortable. It's not out of control. It should not be super painful. You'll feel little pinches, but let me turn your head this way a little bit. That's perfect. Thank you very much. We're making good progress here. And we're going to finish up with the finishing touches of the filler. Thank you for watching. Thank you for sharing. We're on a mission to stop bad plastic surgery. And I'm going to focus on the inframalar hollows. Perfect. I love what I see. We're right on track. When you take little baby steps, it's hard to get into trouble. You can't get from Florida to Texas just like that. You got to go for a long way to get from one place to another. And you can't get to an extreme result without doing a lot of treatment. So when you're doing a little here, a little there, you're just constantly reassessing, saying, okay, well, it looks natural to me. But people get into trouble when they just get too ambitious, try and do too much in one area. When you're blending around, moving around, little here, little there, you're always going to maintain that facial proportion. Sounds simple. We make it look easy, but people are still getting it wrong. They're still getting into trouble. That's why patients come here, because they want to stay safe. We put it in writing that you will look natural. Randy, if you don't mind putting this one into a syringe for me, please. Thank you. For the Bella fill, this one right here. That one, thank you. Okay, so now I'm going to keep focusing on the hollows. Do we still have those pictures? I always like to reference those pictures. Can we leave them up? Can you pull a picture?
Right here.
Oh, we got them over there? There we go. So I'm looking at the pictures. That's perfect.
There you
Okay,
go.
good. Yeah. All right. Very good. Yeah, I'm still going to focus on that little bit of the hollow. Let me turn your head this way. And what I tell patients is you don't want to taste the chocolate cake before it's done baking, because you'll have some swelling, the collagen's going to stimulate from the Bellafill, and once all those things settle down, we get people back at about 2 months normally. Much better, I love that. And we look at the before and after pictures. After we do a treatment, our vision gets better and our memory gets worse. That's why we look at the pictures so people can see what happened. And if they want to add more, you can, but it's always better to do it in a stepwise approach, but you don't want to go too far, and we won't let that happen to you. Let me turn your head this way just a little bit. Very good, very good. Perfect. Let me turn your head back this way. Thank you. I love that. That's really nice. I'm focusing down low because I think that's where she's going to get her best result. Thank you. I see that. That's very good. And then I've got the fine line fillers that we're going to be doing our finishing touches. So this is the Bellafill. Bellafill is made up of 80% collagen, 20% PMMA. The collagen gets absorbed and replaced by our body's own collagen. The PMMA is permanent and stays with you. That's what gives the long-lasting result. Very good, very good. Super. Okay, so now I like to use the 32 gauge needle with the fine line filler. And that allows me to do intradermal injections. You feel a little bit of a pinch here, a little pinch. And it's just really gratifying to see those little creases just plump right out. Let me turn your head this way a little bit. So we're just following across this little crease here. I'm just going intradermal the whole way. Hyaluronic acid, pretty amazing stuff. Perfect. And I'm injecting about 1/10 of a cc, 1/2 of a 1/10 of a cc with each little pass. So always fast, but never hurry. Let me turn your head this way a little bit, thank you. So filling in these little creases, sometimes you can fill them in the intradermal region, sometimes you're gonna plump below, and sometimes a little bit of both, depending on what the situation presents. So we're using both here, intradermal, subdermal, combination overall best result. Our ABCs of plastic surgery help to give us our best results because we make our best decisions with the ABCs. A stands for area. There's only 4 areas that we address to enhance our facial appearance. Number 1, if we sag, then we can tighten. Number 2, we lose volume, so we fill. Number 3, sun damage, wrinkles, and sunspots. We can polish and repair the skin. In the 4th area, better than all the others, that's our behavior. Mary has a great smile. She knows the power of smile. We look our best when we smile. We feel our best when we smile. And none of our treatments look as good as the smile. So a lot to learn from our smile. Okay, so we are done with that syringe, and now I'm going to do another syringe of the Versa, finishing touches, and I may use that cannula as well. And so when I use the 32 gauge, I make sure that's on there nice and snug, and don't keep the injection pressures too high because you don't want to have the needle come off and then you lose your product. That's no fun. Okay, so a little bit of fill through these areas, and I'm just gonna blend because the hyaluronic acid really does a good job blending. Finishing touches. Yeah, I really like that. The creases improve quite a bit. Now, Mary, one more time, open your eyes, and I want you to look straight ahead like you're talking to someone. Make a big smile for me, big smile. It feels goofy to smile. Now relax as best you can. Okay, so I'm gonna blend a little around the eye. So I'm gonna use the cannula and go higher in the nasojugal groove in the infraorbital hollow. Very good, very good. A little pressure, a little pinch here. Perfect. You feel any pinching there or not really?
No.
Very good, thank goodness for lidocaine. So a little bit in the cheek, and then a little on this side, back and forth like a tennis match from one side to the other. Super. Very good, very good. Another way that's good to measure your plastic surgeon or your provider is to ask, are they nice to their staff? And that's important. Just ask the team if they think that's important, if their doctor is nice to them. And I have to confess, as a surgeon, you get busy, you get frustrated about things, and then sometimes you're maybe frustrated with your team. But you really, when you're on top of your game, you gotta be nice to your team because they're nice to your patients. And we do complex things here. We may make them look easy, but that is important that the providers are nice to their team because they're such nice, beautiful people too. It sounds like a simple thing. We were supposed to learn that in kindergarten, right?
Mm-hmm.
But I will tell you, you will see many providers that may not be so nice to their staff. And if yours is nice to their staff, great, but I've seen the opposite. And in fact, I'm guilty of that. I had to learn, I need to be nice. If I'm frustrated, I need to get it under control. And I'm just so grateful, and I love the treatments that we do, and we've got such a good chemistry and energy and experience. Of course, it helps when I've been in medicine over 20 years, so you get the hang of things after a few years. So now I'm just going back and forth from side to side to see what I see, and a little bit here, a little bit there. We're not in a hurry. We take our time. And blending, we get the little poudre orange around the chin, and we fill, and the hyaluronic acid absorbs some water. So now we just love to fuss over the little tiny detail. We're fussy, we're fussing. Fussy, fussing. Mary, do you feel a little pinch there? Not really? A little bit?
No.
A little bit, okay. And every place I inject just keeps getting more and more numb because the product itself has lidocaine in it. And I'm going to finish up here in the smile lines. Very good, very good. Super. The last little bit over here. It's normal that we get little mountains and valleys. Sometimes I have patients start to describe their facial features and they can use really extreme words and severe words, and you got to be careful. So ask yourself this question: are you tough on yourself? Most people are a little tough on themselves, but rate yourself how tough you are, 0 to 10. If you're super, super tough on yourself, well, you should be nice to yourself and kind and loving. Okay, we're going to do a little bit of the wrinkle relaxer for the forehead. But when you're being really tough on yourself, now, Mary, can you raise your eyebrows up real high for me? Now relax as best you can. So I'm going to do a little bit of that wrinkle relaxer so you feel pinch on 3, 1, 2, 3, pinch. Perfect. 1, 2, 3, pinch. So with the wrinkle relaxer, I tell everybody 2 weeks later, raise your eyebrows up real high. Now relax as best you can. If you feel you need a little extra dose, you can add more, but you don't want to go too far. You don't want to waste the product. Pinch. 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 Doing okay?
Mm-hmm.
Very good. Pinch. Pinch. I like to deliver the wrinkle relaxer high above the brow so that we try and maintain a good brow position. We call this our therapeutic acupuncture. It has a way of taking our mind off of everything else in the world. And raise your eyebrows up real, and then relax as best you can for me. We'll do just a little bit down low. Super. Okay, we'll hold some pressure there. Okay, Mary, we're completely done. Hopefully that wasn't too bad. So I like to finish up and take a look.
When the lips done.
Right, we did those little, take a look. Can you see how we plumped in some of those creases?
Mm-hmm.
Now you don't want to taste the chocolate cake before it's done baking because those creases that we fill, they absorb a little water. We'll put your picture side by side, but for now we got to let the dust settle, let the swelling settle down. Make a big smile for me, big smile. See how it plumps the cheeks? Can you? How does it look so far?
Looks good.
Looks good. You got a little bit of swelling. I'm going to have them take pictures of you straight away. And if you walk into the grocery store, nobody does a double take, but that lidocaine takes about an hour for that to settle down. 5-minute massage, 5 times a day for 5 days. Temples, cheeks, smile lines, and right in through this area. That's what I would recommend. 5 minutes.
5 times.
5 times a day for 5 days. That's a general rule of thumb. Any questions for me?
When can I put on makeup and stuff?
No restrictions. We're going to get you cleaned up. You got a little bit of the tiny blood spots from the Botox. And I'm going to give you a hug. You did great. Thank you for being such a great patient.
You did great.
Thank you. I couldn't have done it without you. Thank you for watching. This is how we do it in our office. Full face Bellafill, fine line filler, wrinkle relaxer. We'll see you in the next video. Let's put a plan together for you so you know what's right for you. You can predict facial aging. You can stay ahead of it. And let's do things the right way. See you later.